Testing.
And so everyone else is according to where they're sitting. Talk.
Good evening, everyone. The open meeting law requires that I notify the public that this meeting is being recorded. Therefore, please be aware that an audio and visual recording of this meeting is being made and broadcast by Boston City TV, which is a part of the City of Boston Office of Cable Communications.
Yes, and let's call the meeting to order, if we may, and we'll start with introductions. To my right,
Olivia Richard. I am from Brighton.
Marshall Jacques Yard, Boston Parks and Recreation Department.
Disability Commission from Mission Hill.
Hi, my name is Wesley Ireland. I'm from the North End, and I am a commission member.
Song. I'm from Dorchester and I'm a commission member.
Hi, this is Juan Ramirez from the Boston South End Commission member.
Carl Richardson from Brighton, Commission member.
Paul Karen, live downtown Boston, work up the BPDA.
repeat that, sorry, please.
There's something going on.
There's a
with their
couple of
mics.
mics. No.
Hi, Zaria Amir Hosseini, South Boston, Commission member.
Hi, Kristen McCosh, Disability Commissioner for the city.
And I forgot to mention, my name is Jerry Boyd. I'm the chair of the advisory board, and I'm from West Roxbury. And the next item on the agenda is the approval of the April minutes. Do I hear a motion to approve? Carol moves to approve the minutes.
I second the motion to approve the minutes.
Say it again.
I second the motion to approve the minutes.
All in favor?
Aye.
The motion passes. Next on the agenda is announcements. Does anyone from the advisory board have any announcements that they would like to share? Please feel free to do so at this time. Hearing none, we'll move right along to our first presentation from the Parks Department, from Marshall Yard.
You're welcome. Do you have the clicker on? I don't have the clicker. I think they might have to go to Catherine. I think Catherine has it, but I don't know that. Okay. Thank you. Good evening. My name is Marshall Jacques Yard, and I am the Outreach Coordinator and Park Partnership Manager for the Boston Parks and Recreation Department. I'm grateful for the invitation to be here this evening, and what I'm going to do is just kind of go over a handful of events that we have coming up this summer, and these are in addition to our regularly scheduled community meetings surrounding park redesigns and capital renovations, but this is more of the fun stuff because it's summer, no less. So earlier I disseminated a flyer or rather a two-sheeter of information about summer events in the park, all of which include things like concerts, music series, movie nights, workshops such as watercolor workshops, and our summer fitness series for our constituents. Additionally, we have the annual Summer on City Hall Plaza events, such as the Dot Curran concerts, Donna Summer, and Gospel Fest concerts. It is important to the Parks Department that our events meet the needs of all of our constituents. We pride ourselves on trying to exceed the bar of the diversity of demographics in our constituent base. So whether it is park designs where we try to exceed the ADA compliance but actually meet inclusivity aspects, or summer events, we pride ourselves on doing just that. If you take a look at the summer workshop series, summer fitness series, you'll notice that we offer something called chair yoga for some of our constituents that have limited mobility and access. Any of the programs that are typically offered by the Parks and Recreation Department, if you should call the department, we will make accommodations to get interpreters if necessary, to guide you through where your best entry points are for the venues that we're hosting them. With parks, it can be kind of touch and go, and varying entrances speak to different challenges, but we typically know exactly which ones are the best route to getting you front and center and wherever that location is. We always want to, again, build inclusivity into our programming, so nobody should ever feel left out. I apologize, because in the work that we do, I'm usually used to fielding questions and not necessarily presenting what resources we offer. Just trying to make sure I didn't forget anything. I don't know that I'm going to take up a full 10 minutes, but I can open it up to questions if you should have any. And I can take anything spanning from design and construction to actual events. So, sure. Mr. Richardson, correct?
This is Carl. Could you just go over some, just so I have a better idea of some of the events?
Absolutely, absolutely. So with our concert series, I was explaining this a little bit earlier, we like to move them around throughout the city so that no one neighborhood is getting the wealth of our offerings. And what you may see if you've ever been to any of our concert series is that we try to move them from park to park, even in the same neighborhoods. So what you see here is we have varying local artists on the concert page, starting Wednesday, July 10th at Horatio Harris Park in Roxbury. You can see Chosen. If I skip down a couple more notches, it's Wednesday, July 24th in Ramler Park in Fenway. You can see Swinging in the Fens with Marianne Sullivan. If you happen to be a Mattapan resident, on Monday, August 5th, the Woo Factor. We also have the Tito Puente Latin music series that also starts Thursday, July 11th, and they'll move from O'Day Playground to Mozart Playground, Mission Hill Playground, and Lopresti Park in East Boston. The Dot Curran music series is here on City Hall Plaza, starting Wednesday, July 17th, Wednesday, July 24th, Wednesday, August 7th, and Wednesday, August 14th. And then one of my personal favorites is movie nights in the park. Those go throughout August, Mondays, Wednesdays, and Tuesdays, and the occasional Thursday and Friday from Fallon Field in Roslindale, Walker Playground, the Frog Pond on Beacon Hill, and you can see an assortment of different blockbuster hits and classics that have come. Sundays in the park are a collaboration with the Symphony Orchestra, and those start on Sunday, July 28th at Pine Bank in Jamaica Pond. The watercolor paintings workshops start Saturday, June 8th. They run Saturdays and Sundays throughout the summer into September, and they visit varying parks such as Jamaica Pond Boathouse, Allendale Woods, Christopher Columbus Park, where folks have an opportunity to watercolor just about anything they want, but there will be an instructor that kind of guides you through a theme if you'd like to partake in that. Artist in Residence series workshops are Tuesday, Wednesday, Thursday, and Fridays through July, and those will be happening at McConnell Park, Gertrude House in Roxbury, Doherty Playground in Charlestown, and East Boston Memorial Park in there's also some more, sorry. Joyce Playground, Medal of Honor, Ringgold, and Mozart Street Playground. And then again, the Summer Fitness Series. These are just two of the several offerings that are being hosted in collaboration with the Boston Public Health Commission.
Any other questions from members of the commission? Wesley?
I have a question about movie night. So you mentioned the movie night, but does it have open captioning?
So that is an option. Most of the DVDs are well equipped with the closed captioning option, and so we would naturally put them on if they're presented a need. And in preparation of coming to this meeting, it became a thought in the office, and we said, nobody's ever asked us to do it, but we know that feature's there, so we thought about just implementing it in general without the need for an ask.
Yeah, absolutely. I would recommend you use it as often as possible. You don't want people to have to show up and ask.
Yeah.
It would be nice to just have it automatically on during the movie. It would be more inclusive for your audience and really for everyone.
Absolutely.
Ducey has a question?
Yes. Hi, thank you first of all for your presentation. I'm not sure if it's one or two questions actually. Is regarding the concerts, for instance, I know it's been a while since I've been at concerts, but do you have also like accessible restrooms and first aid stations available for concerts?
So I don't know about the first aid stations, but that is something that I can absolutely find out and report back to the commission for you. In terms of accessibility, it is my understanding, and I've witnessed myself to the many events that we've hosted, we've always asked for at least an accessible sized porta potty that gets delivered. So it's usually, if I'm not mistaken, 2 of the standard size and 1 of the accessible ones.
Yeah, I just the main reason why I'm asking about, for instance, the first aid stations,
Yes.
because they could also be used not just for first aid, quote unquote, but also like if somebody is going through something, through some medical condition or whatever, just so they can be somewhere for the time being until, so they don't have to like, oh, I have to go home now because this happened.
Sure. I know from personal knowledge of events that I've worked that we always have a first aid kit, but I don't know that that will speak to all of the needs of first aid, and my personal training is rather limited, but I will absolutely bring that back to our department and see how we can implement that change.
Thank you.
Any other questions from members of the advisory board? Juan?
Hi, I think you mentioned that people can call you if they want to make some accommodations.
Yes.
In case people do end up calling you, is there a window of how early can they call you so you can make sure that the accommodations are set in place?
So what I'm finding is for sign interpreters, they're asking us about 48 hours. We are actively going to work on a way to try to build some of that infrastructure into our program offerings. If it's something like closed captioning and/or first aids, those are kind of minute to minute. You can give us a call as early in that day, because those are things that we can handle in-house. I think it just becomes a little bit more challenging if we don't have upwards of 48 hours when we're seeking interpreter services or they weren't expressly asked to be there ahead of time.
I know the commissioner has a question.
Sure.
Hi, thank you. Jerry, to follow up on Juan's question, I would say, though, the more notice you can give, the better. So as soon as you realize you'd like to attend an event, you should contact the number on the flyer or website. But my question is, could you talk at all about Martin's Park that's opening on June 30th?
What would you like to know exactly? It's June 15th, Saturday, June 15th
Oh,
is the
June
grand
15th, I'm
opening.
sorry.
Yes.
Okay.
It's going to be something out of this world, and we're excited about it. But what exactly were you looking?
Well, I know it's built to be fully inclusive and accessible, so maybe you could talk about that.
It is, and unfortunately, I am limited in terms of the design aspects for it, as I wasn't the project manager on that particular park. But as I understand it, you're right, all of the play structures have levels of inclusivity, which speaks to much of what a mission we've adopted in the Parks Department, where anytime we go into a capital renovation, we are not looking just, again, for compliance, we are looking for actual inclusivity. So we've started implementing at least one play structure that is fully inclusive, whether it be dish swings and basket swings, and we've had some handicap accessible or wheelchair accessible merry-go-rounds and such implemented. I don't know the specific play structures. I think that's part of the big reveal that's coming with Martin Park. But I encourage everybody to come out on Saturday, June 15th at 10 a.m., I believe. And it's an all-day affair. It really is going to be quite a spectacular opening. Sure.
Great, thank you.
Olivia has a question.
This is kind of self-serving, but will the merry-go-rounds and whatnot be able to support adult wheelchairs and power chairs?
I think they do. I can get, again, that's a question I'm going to ask one of our landscape architects and project managers, because they have better knowledge of the sciences behind the inclusive play, and I can report that back.
Because I know that the ones at Spalding are on the smaller side, because I've played on those.
So forgive me, because I don't know which specs they're supposed to meet with that. So, from a layman's eye, I would say that the ones that I've seen in our parks would fit, i.e. the children's park. But again, I don't know for certain, so let me get you that answer.
Oh, yeah. Thank you.
You're very welcome.
Go ahead, Zari. No.
Maybe you don't want me
There
to
you
tell.
There it is.
Hi.
Hi.
So thank you very much for your presentation. So going back to interpreter request or in general accommodation request for whatever the reason is, I was just looking at your flyers.
Yes.
And you should actually have something that says to people that if they have a special accommodation, who to contact.
Sure.
Because if, for example, you're requesting 48-hour notice for an interpreter, if people don't know to make the request, they might assume that the interpreter is already there.
Okay.
So I mean, for whatever you do, as far as activities, you should put a statement.
Duly
that says,
noted.
If you
I
need
will-
accommodations, please contact.
And
I will
have
share that with our graphic designer.
I have that language, I can forward it to you.
Perfect.
And also the ISA, the International Symbol of Accessibility, the little blue wheelchair icon.
Perfect. I will make sure that our graphic designer has those on hand, and as she's creating them, puts them in.
Great.
Absolutely.
And I know Patricia might have a comment as well.
Sure.
Thank you, Jerry. Marshall, thank you so much for coming and presenting.
Thank you for having
I
us.
personally look forward to working together in park events. I know our constituents often contact us for a question regarding the grass and the viewing areas, so I'm excited that we're going to work together.
And you are always welcome to reach out to me directly. If you call the 4505 number, there's only one Marshall. They will patch you through to me directly, and I can be the conduit to making sure that you all enjoy our events. Absolutely.
Perfect, I'm excited. Jerry, and to go back to the merry-go-round question, so Olivia, in the past year, I met with Lauren Bryant, who is
Yes, Lauren Bryant.
the manager for that project. I don't think there's a merry-go-round, but there's a ship and a lot of other things. And all of the play structures are inclusive. So that's the beauty of it.
Let me be clear, when I mentioned the merry-go-round, we recently, as recent as 18 months ago, installed one in Children's Park on Intervale Street by the Lila Frederick Pilot School. So, and that was after working very closely with the school, because they have many students that need accommodations, and we were happy to oblige. So.
And I just had a comment, Marshall. Again, I echo the board's thanks for having you here today and letting us know about all the nice summer events. Hopefully when the weather will cooperate though, unlike today. But I was at a concert myself last summer, and I didn't see any porta potties or there. So, I mean, is that standard operating procedure that they would have that restrooms available?
Do you
or-
happen to remember which concert you
Yeah, it was
attended?
at Billings Field in West Roxbury.
At Billings Field. I will look into that. Every concert that I've worked, we've had porta johns put in
Okay.
for them, and I wonder if perhaps, and again, this is me speaking off the cuff, I don't know the answer. I wonder if perhaps there was just a delay
Yeah,
or
and
something
maybe I
in
just didn't
transit that
see him,
happened.
but it wasn't, I didn't see it clearly
Oh.
marked or anything like that.
Correction, the field house should have been open. That would have
Okay.
been why you wouldn't have seen porta johns at Billings.
All right, so that has
Yes,
accessible. that
the
has
field house
restrooms.
gets opened for major events.
That has restrooms in it?
Yes, it does.
Okay, great.
Yes,
Thanks so much.
you're very welcome.
I think we're good.
Okay, thank you so much again for having us. And again, if you have any questions, feel free to contact the Parks Department at 617-635-4505, and you can ask for me, and I'll help you out. Thank you again.
Great.
You're welcome.
And And now we have Catherine Carnes from the Boston Public Health Commission.
Good evening, how are you?
Hi.
While the slides are being brought up, I just want to quickly introduce myself and the organization. Oh, perfect, thank you. So my name is Catherine Carnes. I'm the Chief of Staff at the Boston Public Health Commission, which is the city's health department. We're also a sister department to the Disabilities Commission in the Health and Human Services Cabinet. So we work closely together to ensure that all Boston residents are able to live full, healthy lives. And I'm here on behalf of Dr. Jennifer Lowe, who's our medical director, and she's our mental health expert. So I will do my best to answer any questions that you may have, and then if I'm not able to answer them, I will report back to you. I'll get information from Dr. Lowe and report back to you. Great, so as I mentioned, we're the health department for the city of Boston, and our mission is to protect, preserve, and promote the health and well-being of all Boston residents, particularly the most vulnerable. So you'll notice in our mission statement we have well-being front and center because we think it's really important to view health in a holistic way. So that sort of sets the stage for our conversation today about mental health and wellness. And I believe we're here today because May is Mental Health Awareness Month. And I know that you as a board are very interested in exploring this issue, and particularly how we can ensure that mental health services are accessible. Wait for the ringing to stop. There we go. Closer, okay. So I just have a definition here of, can you hear me? I can't tell if it's actually on. It seems to have come off. Can you hear me now? Okay, great. So I've included here a definition about mental health. As I mentioned previously, we like to think of health in a very holistic and broad way. So a definition from our national experts is that mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make choices. Mental health is important at every stage of life, from childhood and adolescence through adulthood. And I think this is just the beginning of a conversation with your board and with the Disabilities Commission about any particular needs that we think the disabilities community may have. We'd love to hear your feedback so that we can be thinking about how to make sure that our services are reaching your community and that we better understand what your needs might be. So I just want to start with a recent quote. So we're in the midst of what we call our Community Health Needs Assessment, and that's basically a project that we're undertaking with all of the hospitals and health centers in Boston to ask residents what their most pressing health needs are. And we heard from a number of surveys as well as focus groups that mental health really is an issue that all residents are concerned about in different ways. And so we have a quote here from one of the residents expressing that many residents are impacted by untreated mental health. Communities and families that have multi-generational issues around poverty, lack of education, histories of trauma and violence. So I think it sort of highlights how complex mental health issues are and how they really relate to so many of the other health issues that we as a city are facing, like community violence and trauma, substance use disorders, and generational poverty. So it's a big issue, a lot to unpack. So I'm just going to share a couple slides highlighting a little bit of data, and I recognize that this might be a little hard to see, so I'm just going to read out a couple numbers for you. So we survey residents every other year, both youth and adults. And from these surveys, we get some understanding of issues of health among our population. And the first slide is related to youth, and these are high school students. So this is the percent of high school students reporting persistent sadness, which is one measure of mental health. across a few years. So we're looking over a longer period of time. And in Boston, the number is about 30%, which is a little bit higher than the state, which is closer to a quarter. So about 30% of youth in our schools are experiencing persistent sadness. And the numbers vary depending on population. So we see, higher numbers among our Black and Latino youth, among our female youth, as well as among our LGBTQ youth. So those are indicators that we might have certain folks who we should reach out to target some of our services, and I'll get into the services in just a moment. For adults, we ask a very similar question, and it's about feeling sad, blue, or depressed. Same years, over 3 surveys, 13, 15, and 17. And it looks like, sorry, I realize the numbers aren't printed on the slide here, but it ranges from about 10% to almost 25%, depending on which group we're asking. And just like with youth, we see differences higher for females and higher for our residents of color.
Catherine, can I just ask, was there any disability looked at?
No, and so this is where I think we have a great opportunity to work together. I know that you've done a disability survey, and I think it would be great for us to sit down and take a look at the questions you asked and think through how we could sort of link our surveys together. But this is our Boston Behavioral Risk Factor Surveillance System, and I can double check the questions that are asked about demographics and see if we're able to link any information about
That'd be
disability,
great.
but I don't think we are.
Okay.
But I'll double check. Just make a note. Okay, so in terms of our services, so we don't have a specific department of mental health services within the commission, but rather it's embedded across all of the programs and services that we offer. And I'm going to share just some highlights. We're also developing a briefing handout on these services that's not quite ready, but I'm going to get it over to the commissioner when it is so that she can share it with you. So some of the direct services that we have are the first 3 that are listed here are all in our Child, Adolescent, and Family Health Bureau. So they're specifically targeted for youth. There's the Early Childhood Mental Health Program, which is for young kids, and that's in partnership with community health centers. Healthy Baby, Healthy Child is for parenting or pregnant moms and newly parenting moms. And then our school-based health centers, which reach school-aged kids and high school kids. And then also in our Homeless Services Bureau, so in our shelters, our homeless shelters, we provide mental health services as well for folks who are staying in our shelters. We also have a number of programs that address violence and trauma associated with violence. One of them is our Neighborhood Trauma Team Network that offers services to residents experiencing trauma due to community violence, and they are able to provide services one-on-one or in group and community settings. And then we have the Safe and Successful Youth Initiative, which works specifically with youth who have been exposed to violence and have a risk of engaging in violence. And then our Family Justice Center, which is very related to trauma associated with trafficking and sexual violence. And then we have a whole suite of programs that are related to substance use disorders, and they each incorporate mental health services for folks who have comorbidities, so residents who have both mental health conditions as well as substance use disorders. And we have those in a variety of settings. So we have the first 2 that are listed here are for women and for men, and they're both outpatient programs. We also offer services through what we call our engagement center, which is a low threshold site. It's essentially a big sturdy tent where folks can come in. Folks who, many of whom are living on the streets, can come in and access, a cup of coffee, a computer to work on their resume, or if they're feeling ready, they can talk to staff. And then our PATHS program, which is really a referral program. So if anyone needs services, they can call or walk in and get referred. We also do a lot of work to train our public health providers who might be interacting with residents who need support. So our emergency medical services, our ambulances, have a series of training programs to make sure that EMTs and paramedics know how to support folks who might be having a mental health crisis. And we also do work with our Ryan White Services, which is a program for persons living with HIV, so training providers. And then lastly, we have our violence prevention division provides trainings on trauma-informed care. So that's helping providers of many types work with residents who have experienced trauma and might need additional support to engage in care. I did want to share a little bit about the work that we're doing as an organization, and so this affects all of the services that I've just mentioned around strengthening accessibility. So we have an ADA compliance work group committee that is looking across our campuses and programs to improve the accessibility. So we have recently expanded the availability of TTY lines, adding software at public computers for those who have vision impairments, and then strengthening our policies around accommodations for those accessing services and for those looking for information on our website. And then we are also rolling out some new signage that we're currently piloting at our headquarters. So beyond the services that we provide, there are other services available. So our Mayor's Healthline is listed here. That is one of our programs, but it's listed with the resources in the city because it's really a referral site. So you can call and access, get information about accessing health insurance and figuring out which providers are, mental health providers are in which networks so that you can ensure that you have insurance coverage. And then the other services are just a sampling of other resources that are available in the city, and they each have different populations that they work with, like Boston Glass works with LGBTQ youth, for example. The health centers are throughout all of the neighborhoods, so they reach folks in their communities. And the vast majority, if not all of these sites, have accommodations and accessibility considerations. So in terms of how we're moving forward, I think we recognize that mental health is continuing to be a priority issue for Bostonians, and in fact, it's something that we're seeing more concerns about. And so we are, doing some work to inventory resources out there, like the ones that I've just shared, but also thinking through how best we can collaborate to make sure that we're providing the best services, and also figuring out how best to track what residents' needs are. So opportunities like this to come meet with you and hear what is concerning are really important because we want to hear from you. And then, addressing any gaps that we see. So, looking for, I think that's the last slide. Yeah, looking forward to the questions that you might have and continuing the conversation. Yeah.
Catherine, can I just ask you to give a brief, 1-minute summary of Long Island?
Oh, sure.
And I don't know if it's still open for public input.
I believe the public input may have just ended. So as many folks may recall, Long Island in the Boston Harbor had been open until I think it was 2013 or 14 when the bridge was deemed unsafe, and so we had to move the services off of the island. Those services have all been restored on the mainland, so to speak. But we're in the process now of planning to figure out what a new recovery campus could look like. And so this is being led by the Mayor's Office of Recovery Services. And the goal is to sort of re-envision a comprehensive recovery campus that would provide a range of services for folks with substance use disorders. But obviously mental health is a big part of that. And they were taking public comments and hosting community meetings to get feedback from residents, and they're doing sort of what we would call a master planning process to figure out how to move forward with the plans, and also assessing the infrastructure of the island. So there are buildings on the island that they need to determine how to modernize them.
I can look into the office that's taken the comments and see
Yeah.
if the board wanted to compose a letter, if you were interested in that.
Yeah.
If we could still submit it. Because I
Yeah.
believe they just ended like last week.
Yeah, I think so, but I'm sure they would be glad to
Yeah.
accept a
And
letter.
we
Yeah.
can submit it anyway, even if they don't officially put it in the plan.
Yeah.
That sounds like something that we definitely would want to consider, so I can outreach to members of the executive board and the rest of the board to firm that up, so. But do we have questions from other members of the advisory board? Felicia has one.
Hi, thank you for this presentation, I appreciate it. In the beginning, you mentioned in the survey, you asked about who's blue, who's sad, that kind of thing. Did they think about adding in that language of asking about anxiety? That's the first question, because anxiety is a little different from dealing with sadness and stuff. So being anxious and not doing something is important, and how a person functions, I live with that. So I think that asking that question, you might glean a little more information versus just asking whether you sad or blue. I mean, because that doesn't cover it for me, so.
Yeah.
Also, I saw a lot of information for youth and adults, but it doesn't specifically talk about elder depression. And elder depression is a big thing because they're coming from a generation that doesn't talk about it at all, yet they're living with, and it also impacts, when you're depressed and or stressed, it has a huge impact on their life, especially if they have another mobility. So I don't know, are there resources that are specific for elder health and depression, mental health and depression?
So in terms of the first question, I shared two data sources. One is a survey that we do every 2 years, and one is a special survey that's being done this year with the hospitals and the health centers. The special survey also had focus groups that accompanied it, and one of the focus groups was with elders. Both among the elders and among the others who responded, they did report concerns about anxiety. So that did come up as a high priority issue. And then in terms of elders, so we are able to, and I don't have them with me today, but we are able to look at those survey results by age. So we could take a look at it. But yes, I think, so I can't give you the numbers, but anecdotally, yeah, we definitely see, high rates of various mental health conditions among elders, and I know that's something that, folks are concerned about, being able to provide services. Our other sister department, the Age Strong Commission, which is a separate agency, does a lot of work to help elders, and we work together to make sure that we're meeting their needs. So I don't know offhand of anything specific, but I can find out.
Okay. So the last thing was, you mentioned the work that you'll be doing with
Can you speak into the microphone?
the work that you'll be doing with this commission. I'm interested in seeing, what that looks like. I know you're going to be working very profusely with this, but because it's new for me, work in depression and trying to manage my life, it's been huge because it's new to me. I wasn't born into it. So, there are a few folks that are coming from a work life that all of a sudden depression is part of that, or anxiety is part of that, or whatever the mental health issue is part of that life. So it's difficult to handle. So now you have to kind of identify that you've got a disability. So it's really, I'm not saying that you're not looking at this, but I'm just excited to see that the work that's going to be happening here, what it's going to look like,
Right.
in terms of resources and how you meld together all the other agencies and really look at this topic widely. So I'm excited about that.
Thank you.
I know Olivia has a question.
I noticed you noted that you offer peer support and mental health training for EMS. Do you also extend that to the fire department and to the police? Or is it EMS because EMS is directly under the BPHC purview?
So it's part of their training program. So it is specific to EMS because they have requirements as they are recruited into the team as paramedics and EMTs, and then throughout their service, it's required. But of course, EMS and fire and police work so closely together. So, I mean, it's certainly something we could explore. I think there's different levels of training that is offered. They have a long training program as they become new EMTs and paramedics. So it might not be practical to offer the full scope, but we could certainly look into thinking about a one-day training or condensing some resources to share with them. I will say for the police, and I think this was up on the slide, one thing that they do have, which is a great resource, is the BEST team. So the BEST team actually pairs mental health clinicians with police officers in the field. So they are able to accompany police officers to respond to incidents or calls where they believe mental health conditions might be complicating the response.
I believe the police do training in that. It wouldn't be under BPHC, but it would be under the BPD.
Okay.
But I can get you more information on that.
Yeah.
And it's certainly something that we could be more involved in as well.
Yeah.
Great. And Ducey has a question?
Yes, thank you again for your presentation. I am actually really excited about what you're doing. And I also want to piggyback on what Felicity mentioned that you are, I'm really excited that you're collaborating with the Boston Disability Commission, and I'm probably asking the same question everybody else was asking maybe. I want you to do like specialized training for mental health specialists, for example, for families, because there are like different families who, for cultural reasons, for example, they have someone in their family who's on the autism spectrum or other relations they have. I mean, it's hard for them to even say, due to cultural issues, they have sometimes embarrassment. They don't even know how to address it or even to see that there is something going on. So is there like specialized training for that as well?
So I hear you talking a little bit about stigma, and that's something that we've heard from focus groups and from a lot of residents, across the city in different communities. And so that's something that we want to explore some new work around. So that's definitely something that's on our radar. In terms of training families, I don't believe we have anything that's specifically a training for families, but a number of our programs in our Child, Adolescent, and Family Health Bureau focus on working with families, especially families with younger children, to help coordinate care and services for the kids in the context of a family.
Great. Paul has a question?
Thank you. I think Olivia made a good point with the BPD
Yeah.
about having an advocate with them. You wouldn't happen to know what the ratio would be? When, if someone gets a call in a section of Boston and there isn't an advocate, someone to go help, and the police show up, if they're not properly trained, is there any kind of ratio, like 1 for every 20 police officers, 1 per station, or?
I would have to find out.
And another question I had was any kind of advocacy programs for employment with people with disability through your agency on helping get jobs? I would say, I know you're doing a great job with adolescents, but mature adults, and many are educated. Do you offer any kind of programs?
We don't have a specific program. We have participated actually in the Disabilities Commission adult internship program. I personally had an intern a couple, I think it was last summer.
Because I know there's some like state advocacy programs for people with mental disabilities. That, they offer jobs and training and everything. I was just curious at the city level.
Paul, I think that brings up a good point that maybe we could have somebody from Human Resources come to a board meeting and just talk about employment within the city for persons with disabilities. It's probably a little bit out of Catherine's purview, where it's more Human Resources related in that division But I know Catherine and other of her staff have taken our interns, and the internship program that we do is with Mass Rehab. It gives 10 adults with disabilities who are job-ready a chance to come and work for the city for 6 weeks in a paid internship and really show their skills, get to make connections. And from that program, we've had 3 or 4 people get full-time city jobs. So it is a great experience, but we'll
Thank you.
definitely follow up on that.
Thanks.
Zari has a question?
All
Go
right,
ahead.
so my question was about the survey, the special survey that you had done. You said that you got the data through hospitals. Were these from the care providers or patients who had self-identified?
So the surveys were done in the community. We worked on the survey with all of the hospitals. So as you may know from your roles in the community, lots of people want to hear from residents, and sometimes it can get a little burdensome. There might be 10 different surveys that are out in the community at the same time. So we worked on one survey. All of the hospitals and all of the health centers and the Health Commission and a number of partners worked together to just create one so that we wouldn't overburden our residents and we could get good information. So the surveys, while they were for the hospitals, they were actually done in community settings. So we worked with different community organizations. So they were delivered at community meetings, through various service sites. It was available online.
So, Catherine, I just had a follow-up question. This is Jerry, in regards to that. So is the survey currently, it's no longer active, or is it currently active?
It is closed, yeah.
Okay,
Yeah.
great.
But we can accept feedback from your group outside of the survey, so it's not too late to share feedback.
Sure.
Yeah.
I know Wesley has a question.
Yeah.
Thank you for your presentation. I have a question about what I saw on one of the PowerPoint slides. You had mentioned something about an extension, expanding your services, and for TTYs. And so I'm a little bit surprised because that's kind of outdated in technology for the deaf community at this point. And I know maybe a few people that actually still use TTYs, but they typically use other ways of communicating. Text messaging services, I don't know if you have something like that, but that's very common. I'm sure it'd also benefit hearing people who may not want to call and talk on the phone and they'd prefer to text instead.
Great, thank you for that feedback. So I believe the Disabilities Commission, oh, I'm sorry.
So when you said that you were expanding services by adding TTYs, why was that decision made?
Yep, so I believe they wanted to ensure some minimum accommodation at every site. So there were sites that did not even have TTYs. So I believe the Disabilities Commission had a hearing earlier today, is that correct?
We did.
Yeah, and I know that our, the person who leads our ADA compliance work group wants to get feedback through this process to understand other ways that we can improve our accessibility and make accommodations. So that was one initial step, but it's really important feedback to hear that that might not be the best technology. So so I've made a note about text messaging. If there are other technologies or approaches that would be beneficial, I'd be happy to take that back to the folks who are looking at this.
Yeah, video phones are more common now. TTYs are really, like Wesley said, they're really old technology. And we wouldn't recommend expanding them any more than you have.
Don't worry,
Because people don't use them.
Yeah, I think the word expanded might have been a bit of a misleading. It's more that we were making sure that we didn't have sites that were lacking some form of technology. We're working on improving our technology in general, so we're happy to take advice to move us forward into the current century.
Great. And Juan has a question?
Yeah.
Yes. Hi, Catherine. Thank you for your presentation. Just very quickly, I was wondering if there are other indicators or measurements that the city is following over time to measure the health, the mental health of residents around the city. I think Felicia mentioned perhaps anxiety. Are there others that are kept under the radar of the city to follow this? The other question I have is the data source of all the surveys, the data collected, is that open to the public? And if the Office of Boston Public Health is open to collaboration with groups that are interested in knowing more about the data collected?
Sure. So the population health survey that we do every other year, it's open to the public. It's what's called a random digit dial survey, which basically means that we sample to try to get a representative group of residents. So people get a phone call, you're sort of selected through a sample, and we hope that the sample represents residents. So it's meant, we can't ask every single resident, so basically this is a statistical way of getting a representative sample of residents. And that survey is where the questions about feeling sad and blue come from. But in addition to that survey, we also look at a lot of other data, and we can look at data from healthcare utilization records, so hospitalizations, for example. We can look at vital records, which would be like birth and death certificates. So for example, we can look at suicide rates, and that's something that we track and pay attention to. We also look, as we discussed earlier, EMS is part, emergency medical services is part of our organization, so we can look at their data. So if someone is transported to a hospital because they have a mental health incident, it could be, a suicide attempt or some other mental health crisis, we could look at those data. So there are a lot of other data that we can look at. In terms of the survey, I'd have to go back and ask them what other questions are relevant, but that question is the broadest question. So that's the one that sort of is the most general, so captures sort of the full range of experiences, but there are more specific questions that I'd have to
And I believe there's a
request.
link that we can send out with information on the survey. I think we might have gotten that at the cabinet meeting last week.
So that was the survey that had just recently closed. We can absolutely send that out. And then the bigger population survey is actually about to go out in the field now, and we can share that too. So you can look at both of them.
Great. I think we have to wrap up now to get with the rest of the agenda, but I see folks have additional questions. They can certainly funnel them through the commissioner's office to get to your group. We really appreciate you taking the time to be with us today.
All right, thank you so much. I appreciate it.
Great. Next, I believe on the phone, we have John Kelly, who is going to talk to us about assisted suicide. John, are you there?
Yes, I am. Can you hear me?
Can people hear John on the
Hello,
phone?
Jerry?
Yes.
Yeah, John, I can hear you. We can hear you better now.
Okay, my apologies. I've had some technology problems, but I don't know if my handouts were able to be printed or not, but there were, I think, 6 of them.
John, I
Were
emailed
they
them to the
printed?
group. I emailed them to the group, but I did not have time to print them out.
Oh, okay. Well, that's okay. Well, my name is John Kelly, and I'm the director of Second Thoughts Massachusetts. Oh, just one second. My helper is here, and he's going to help me get closer. Kenneth, can you turn my power on? Okay. On the wheelchair? My wheelchair turned off suddenly. Turn the power on the wheelchair. It's right up here on the display, right next to the lap tray. Right at the lap tray. I'm very sorry. Can you hear me better now?
Yeah, we can hear you very well, John.
Okay, great. Thank you very much for fitting me in. My name is John Kelly, and I'm the director of Second Thoughts Massachusetts, Disability Rights Advocates Against Assisted Suicide. We are the state affiliate of Not Dead Yet, the national grassroots group that formed in response to the killing spree of Jack Kevorkian. Most of his victims were not terminally ill, but disabled, but the media never would correct that misperception. Mainstream society constantly mixes up the lives of people living with disabilities and people dying of serious illnesses. What disabled people share with dying people in the minds of many is a low quality of life, a life that is not worth living. This is the mindset of better dead than disabled. And, there's plenty of movies promoting death for us. I'm paralyzed below the shoulders. And whenever I see myself on the big screen, you can be sure I'm pining away for a quick death. I'm just going to briefly review our usual talking points against assisted suicide, and then I'll talk about how these bills are aimed directly at disabled people. We make three main points from a public health perspective. Our first point is that millions of people are misdiagnosed every year, including thousands of people labeled terminally ill, meaning 6 months or less to live. Doctors are wrong all the time, and the statistics are that between 12% and 15% of people who get a terminal diagnosis will outlive their doctor's prediction. These bills put everyone in the state under threat of death by a simple misdiagnosis. A good example of this is a letter from Jeanette Hall to the Boston Globe in 2011. She believed that assisted suicide was necessary to avoid suffering, so she voted for the bill in Oregon, and when she herself got diagnosed as terminally ill from cancer, she asked her doctor for the lethal drugs. Over a few visits, he persuaded her to try more treatment. She finally agreed, and 19 years later, she is so glad that she changed her mind. Assisted suicide laws inevitably kill innocent people who are nowhere near dying. Disabled people are especially vulnerable to misdiagnosis. Many people in our community have been labeled terminal, some more than once. So, these bills are promoted as giving people a choice. The bill is called End of Life Options Act, but you can't have a choice when you don't have accurate information. You also don't have a choice when insurance companies and state Medicaid refuse to cover your prescribed treatment. For example, in California, Stephanie Packer, who has scleroderma, she received a letter from her insurance company just after the assisted suicide law went into effect. When she checked to see whether the insurer would cover assisted suicide, she was told that her copay would be $1.20. Disabled people know what it's like to be denied options for better living. You also don't get a choice when you are abused or neglected or coerced. 1 out of 10 people over the age of 60 are abused every year, whether financially, emotionally, or physically. Most abuse comes from family members who may be more interested in inheriting the person's estate than keeping them alive. An heir, someone in line to inherit after someone's death, can serve as a witness to the suicide request, pick up the drugs from the pharmacy, bring them home, and even administer the drugs without anyone knowing. That's because there's no official witness required at the death. The law gives complete immunity to everyone involved. One second. And there's also a huge difference between people who support assisted suicide and oppose it. As the voting results from ballot question 2 in 2012 show, assisted suicide pits wealthier, whiter areas against those with more working class and people of color. In a national survey, Black people and Latinos oppose assisted suicide by 2-to-1 margins. For example, the 4 most Latino cities in the Commonwealth, Lawrence, Chelsea, Holyoke, and Springfield, all voted strongly against question 2. If assisted suicide was a benefit for everyone, it wouldn't be just one social group using it. The group of people who will be threatened first with these bills are people experiencing depression. The bill doesn't care whether you are severely depressed, as long as, in the opinion of a psychologist, the depression does not cause quote-unquote impaired judgment. As Ruthie Poole of the state group Empower testified at the last session, Empower is an advocacy group for people with lived experience of mental health diagnosis, trauma, and addiction. Ruthie testified that, quote, "Those of us in Empower know that depression is insidious in how it affects thinking. Against the new provision of requiring everyone to get a psych consult, we know that depression does impair judgment. As a therapist once told me, depression does not cause black and white thinking, it causes black and blacker thinking. Absolute hopelessness and seeing no way out are common feelings for those of us who've experienced severe depression. Personally, as someone who has been suicidal in the past, I can relate to the desire for, quote, a painless and easy way out, unquote. However, depression is treatable and reversible. Suicide is not. These bills specifically target disabled people because better dead than disabled is a belief that's all too often acted on. When you look at the reasons reported out in Oregon for people's end-of-life concerns, it's all about disability. First is distress about dependence on other people. Losing autonomy, they call that. That's over 90%. Second is distress over lost abilities. That's about 90%. Followed by feelings of shame and loss of social status. That's called loss of dignity. As Not Dead Yet says, we don't need to die to have dignity. And then there's distress about needing help with incontinence. That's labeled, quote, losing control of bodily functions, close quote. These reasons suggest a meaning of dignity that depends not on everyone's inherent worth, but on an ability-based meritocracy. This sort of dignity is fragile and easily lost through disability. The people whose suicides are informed by these views, proponents admit, tend to be wealthier, more educated, and people with a strong preference for control. And they tend to be white professionals. Unfortunately, white professionals also dominate the media, medicine, and every institution. The lives of non-terminal disabled people share many traits with people who are in line for assisted suicide. But we reject as bizarre and dangerous the notion that personal dignity is somehow lost through reliance on others or because we're not continent every hour of the day.
John, can you talk about the bills?
Sorry?
Could you talk about the bills?
The bills would set up a two-tier system under which some people would get suicide prevention while others would get suicide assistance. The difference between the two groups would be based on value judgments about so-called quality of life. Many of us already get told straight to our face and through medical hostility that we might be better off dead. Legalized assisted suicide makes that prejudice official policy. Groups that in Massachusetts that have stood with us against the bill include the Boston Disability Commission, Cambridge Disability Commission, Disability Policy Consortium, Empower, and at various times, independent living centers. And nationally, every major disability rights group that has taken a position has come out in opposition to assisted suicide. So what we want is to make sure that people have the choice and supports to live pain and burden-free at home, which is why ADAPT is leading the way to pass the Disability Integration Act, so people would not have to choose between going to a nursing home or perhaps taking assisted suicide. So I hope that you will continue to support us in our efforts against assisted suicide by writing a letter to the Joint Committee on Public Health. And there will be a hearing, hopefully in late June, and I hope members of the board could come testify against it. Thank you very much.
Thanks, John. Do you have the specifics of the bill?
Sorry?
Do you have the specific bill number, or?
Yeah, the bill is H 1926, and an identical bill is S 1208.
And those are in the...
And they're called the End of Life Options Act.
And that's in the...
And what's kind of ironic is if you read that title a little differently, it's the End of Life Options Act. And people feel like they may not have a choice because they can't get home care, their homes are inaccessible, people may abandon them, and we say let's not abandon anyone.
And those are both currently at the State House?
Yeah, they're in the Joint Committee on Public Health, which has been reconfigured for this session. And unfortunately, of the 17 members on the committee, 9 are sponsors. So we're going to have to turn a couple of sponsors to opponents. But, you know, I think the very best argument is the misdiagnosis argument. Just like the reason that many people oppose capital punishment is that 4% of people at least are innocent and would be executed. With assisted suicide, it sets up its own death penalty, and that 12 to 15% of people aren't dying and may, you know, live months, years, or decades longer.
John, will you keep us updated on the date of the hearing?
We don't know exactly.
Can you update us when you get the date?
We were told in June, and I hope that means that it'll be late June because we haven't heard But up at the State House, they can do anything they want. They could give 24 hours notice if they want, but usually it's a little bit longer lead time than that.
Can you update us when you get the
And in the
date?
previous two sessions, we had a legislative briefing at the State House where I and other disability rights advocates presented and answered questions from legislative aides and some reps and senators.
Sure.
And we would hope to do that
John.
maybe in a few weeks.
John, it's Jerry. The commissioner was just trying to say, can you keep us informed about when you hear about when the hearing is so that you can let us know?
Definitely, definitely.
Great, and I'm going to open it up to questions now from members of the board. Does anyone have any questions? Zari has a question.
Hi, John. This is Zari.
Hey, Zari.
Hey, how are you? So I guess my question is that if this bill,
I'm sorry, Zari, I'm having trouble hearing you.
okay, is this better?
Yes.
Okay. So if what you're proposing passes, then basically what it says is that in Massachusetts, assisted suicide would be illegal. Is that correct? I just want to make sure I understand.
I'm sorry, I'm having trouble hearing you. Maybe Jerry, you could summarize Zari's question?
Zari's question was, she just wants to make sure if the bill passes, what would become law here in Massachusetts?
Well, if it passes and the governor signs it, yes, it would become law. The Maine House of Representatives just passed their so-called Death with Dignity Act, and if the Senate approves it and the governor signs it, then it would become law.
So
just like the Massachusetts bill. There's two other possibilities for it becoming legal. There's a lawsuit by Dr. Roger Kligler against the state, saying that he should have the right to state assistance in, getting poison to kill himself. And then we assume that if it neither passes out of the legislature or through Supreme Judicial Court ruling, that they would do a ballot initiative in the 2020 election like they did in 2012.
So again, John, I just want to be clear. If the bill's currently passed, that would legalize assisted suicide, correct?
That is right.
Do we have any other questions from the advisory board? Hearing none, I thank you for your time, John.
Okay, thank you very much.
And moving on in the agenda is the chair's report, and in the interest of time, I'll keep my report very, very brief. I just want to thank those of us and members of the public who are here who were able to attend the City Council hearing earlier today, sponsored by Councilors Flynn, Edwards, and Flaherty. And basically the hearing was just to hear from the disability community about what are our issues facing the disability community. And we had several people testify. The commissioner, spoke and answered questions, as an expert and as an advocate. So I just really want to appreciate and want to thank everybody's participation in that meeting, and hope it signals an ongoing dialogue between the council and our community. So I want to thank everybody for that. And also, what I want to emphasize or discuss just very briefly is I love how everybody here is so active and invested, and the commissioner does as well. And we propose every month, we propose several different speakers to come and present to us and whatnot. But if I could ask the different members of the board to funnel those requests through me, and so I can work with the commissioner and her office to really see which departments are available to present on a given month, because sometimes it takes several months for a particular department or for a particular topic for us to get an expert to come talk to us, and if different members of the board take it upon themselves to try to arrange somebody, that can make it difficult for the agenda. So I really appreciate all of our wanting to make these meetings as useful as possible. I still want to encourage us to do so, but if you could just funnel those requests through me, and I'll work with the commissioner's office to get those folks on the agenda as quickly as possible. So with that, I'll move it on to the commissioner's report.
Thanks, Jerry. My report is also very brief this month. To follow up on Jerry's comments about the hearing, I want to thank everybody also who was able to attend. And for those of you who weren't, I understand everybody's busy, but you should know that your concerns were most likely very well represented. At the end of the hearing, which went for 2 hours, over 2 hours, I just had made notes and I gave a brief summary of the issues that came up. And it was a broad spectrum of disability issues, as broad as I could have hoped for. It was everything from parking to emergency management to historical building access, mental health, communication access, language, ASL, service animals, curb cuts, MBTA, housing, employment. It was really the AAB bill. It was really everything that we talk about every month. So it was a great hearing, and as Jerry said, it will only be the beginning. And I would also emphasize that like Jerry said, we appreciate your feedback. We want your feedback and input. Continue to let Jerry and the executive committee know what topics you want to learn about. And also, we should talk about getting the subcommittees going so we can get some work done outside of the meetings, because we only have 2 hours and these meetings go by very quickly. So keep that in mind also. One thing I want to follow up on John Kelly's presentation. Before the meeting, we had discussed a little bit how this board had written a letter of support in 2012, 2015, and 2017 when the bill was up for vote. And he had asked if the board would consider writing another letter of support. So I wanted to put that out to the chair if you want to call for a vote. If you don't, that's your decision. Secondly, I wanted to just touch on one event that I went to 2 weeks ago was an event in New York City. I was there for 4 days. It was a conference where all the disability commissioners from across the country got to meet up. There were, I think that we do a monthly call, and I think there are about 30 of us on the call. But in New York City, there were 12 cities that attended. It was New York, LA, San Francisco, Cambridge. Rachel Tannehouse came. And Houston, Baltimore, Philadelphia. It was a great mix of commissioners. And it's interesting because we all work on the same things, everything from bike lanes to communication access to snow removal, the cities in the Northeast, to Uber and Lyft and public transit. So we really got to connect. And we talked also about doing some collaborations to have a unified voice on the national level as far as policy is concerned, so that maybe we as a group can write a letter in support of, major federal issues. So those are our next steps for the group. We specifically focused on economic empowerment, and that's everything from financial workshops for people with disabilities to insurance training on how you can maintain insurance and go to work, things like that. So the City of Boston does have a financial empowerment office, and I can get information out about that. And possibly even have them come to present. So it was a great experience, and I learned a lot, and I have a lot to share in the coming meetings. Other than that, I just wanted to announce dates of upcoming events. Our community forum is going to be on Friday, June 28th, from 2 to 4 at Suffolk Law School. Our ADA Day is Tuesday, July 23rd on City Hall Plaza. It's from 12 to 2. Martin's Park opening is June 15th. I'm glad you, Marsha corrected me on the date because I don't want to give the wrong date. And I believe that's at 10 a.m. And it's located just behind the Children's Museum on the waterfront. So it's a great location. And that is it for me.
Okay, ADA.
Great. And next on the agenda is the architectural access update with Patricia.
Thank you, Jerry. Is it okay if I just give me here? So I can
Sure.
do the mics. Hi, everyone. My name is Patricia Mendez. I'm the Architectural Access Specialist for the Disabilities Commission. And I'm going to do a brief architectural access report. I also went to an exciting training, and it was about fair housing training, and I got exposed to lots of great information regarding federal law for accessibility regarding new construction and residential. So the training, I learned a lot in the training, and the takeaway is the great website that they have with available webinars that are all sponsored by the federal government, so they're free of charge and open to the public. So I'll be happy to share those links as a follow-up of this meeting. It's fair housing information. The other exciting thing that I want to share is that we had the emergency preparedness training last week. It was fun and successful and informative. We had the presenter from the state that came and brought backpacks filled with items that we can all use for different kind of disasters. We also had staff from the city agencies related to first response, and they were able to respond questions from the community. And we had great feedback from that day. So we're planning another one for next year, if that's okay with Commissioner.
Yeah.
Going back to the fair housing training, I would like to bring that training here to the city for next year as well, the fair housing regulations. Next, we met with the proponents for Winthrop Square Park, which is the small triangular park in front of the large development coming up into the city, the tall Winthrop Center. So in front of the Winthrop Center, it's going to be the Winthrop Square Park. And we are talking with the proponent and with BPDA and talking about materials to make sure that the accessible path is all nice and smooth for everyone. We attended the ribbon cutting for Harmon Apartments. It looked great. It's in Dorchester. It had 36 accessible units. Next, we met with the chair of the Commission for Disabilities for Lexington, and we shared our city regulations regarding sidewalk materials. Last one, we met with the development team for Kenmore Square redevelopment. They are building new towers very close to the Citgo signs, so a lot of growth in there, and we discussed, again, the accessible path and the public right-of-way, making sure that it's all smooth and continuous and accessible for everyone. That's it for me. If anybody has any questions. Oh, Carl, hold on.
Carl has a question.
So Patricia, is there any update on the replacement for Tom Hopkins at the Architectural Access Board?
Yes, Carl, thank you for your question. Yes, every 2 weeks I attend the Architectural Access Board meetings, and the update that I have is that the representatives from the AAB, Walter White, Walter, I can't think of his last name, I'm sorry. Walter and Don Guerriello are in the committee for selecting the new executive director, and they met and they looked at resumes, so that is in progress. Next, they will be calling for interviews in the upcoming weeks.
Okay, thank you.
You're welcome.
Any other questions for Patricia? Hearing none, thank you. I don't believe we have any outstanding old business or old action items. Am I correct in that?
I don't think so.
Great. So, under new business, what the commissioner brought up the fact that this advisory board has in the past, when there has been a bill for, for assisted suicide up at the state house, that this board has drafted a letter in opposition of that. Is that something that I can move that this board take up? Carl?
I make a motion that we draft a letter similar to that we did in the past to support Second Thought and oppose the two bills that are at the state legislature.
Any second?
A second.
Any discussion? All in favor then?
Aye.
The motion carries.
Can we say all not in favor, just to get it on the record?
All not in favor?
Because I know some
I
people
don't think
aren't.
there's any.
Okay.
Oh,
okay.
sorry. So who would like to work on
Can you record that, Olivia?
Yes.
drafting a letter?
I have
Go ahead, Carol.
since we already have letters that we've drafted in the past, can we simply just copy the language from before and just put in the new bill numbers?
Yes, I can do that.
Yeah, that way
Great,
we're not reinventing the wheel.
right. Okay, that's great.
Okay, I'll follow up with John about this.
Great, excellent. Now we've reached the public comment portion of the meeting. Do we have,
One more.
sorry, Carol?
Didn't you have a motion that you earlier wanted us to maybe write a letter or something on? I remember you saying something at the beginning of the meeting.
There were two on the Boston Public Health Commission, I believe. One was, I'm sorry, can you? Oh, one was on Long Island. Yep, if you want to support a letter to express support for reopening the bridge. There's some contention right now. The city of Quincy does not want the city to rebuild the bridge, and the mayor feels really strongly about reconstructing the bridge so that we have access to the island.
So just
services.
so I'm clear, there's discussion around whether this advisory board should write a letter in support of reopening the bridge?
Correct.
Well, with the bridge, so I have a question in regard to Commissioner McCarthy's comment, if you don't mind.
Go ahead.
Would the opening of the bridge facilitate the rebuilding of a mental health center?
Mental health is a big part of Long Island. I don't know if there'll be a specific mental health center, but it's a big part of the substance abuse issues. So, and there is more information available on the Long Island project. If the board would like, I can send that out before you vote on the letter. Would that be helpful?
I think so, because I'd like to know what the disability component is for
Okay.
the Long Island Bridge.
I'll send that out tomorrow.
Sure.
We can put that for old business next month.
Great. Thank you. And thanks for bringing up that issue, Carl. Now I think we're at the public input portion of the meeting. If anyone has an issue on it, comment around anything they've heard tonight or any other issue, please make your way to the podium and state your name.
Nope, I'm giving you more room. Thank you. There you go, keep going.
Hello again, everybody. It's David Vieira from Hyde Park. I have a couple of things I need to catch up on first. I've missed a couple of meetings. I know in the past we've had discussions about bikes in the city, and I know that Commissioner McCosh had spoken to Captain Andres. Did I catch up on the fact that Captain Andres from BPD is no longer handling bikes, Commissioner? Did you know that?
Yes, I did know that.
Yeah, okay, I thought so. So I've asked, has there been any comments on bikes since my last attendance? Can you recall?
I don't believe so. I need to link up with the new person in charge of bikes.
Is there a new person?
I don't know. I can find that out.
I've asked Counselor Flynn to do that.
Okay.
He's going to be talking to the police commissioner, and we're going to talk next Friday.
Okay.
And I've also asked the counselor to look into the fact that a lot of our crosswalks are still in disrepair. And when I spoke to Public Works last year about a couple of crosswalks that were washed out, they told me that the schedule is they go by neighborhoods, which does not address the fact of crosswalks that need to be repainted now, not 5 neighborhoods from now. So Counselor Flynn and I are going to talk about going to Public Works and having a hotline for people who can call in with specific crosswalks that are washed out so that they can send a team over outside of the neighborhood schedule to
We're
get.
actually working with Public Works on establishing a process for ADA-specific issues like curb cuts, intersections, things like that. It's in the very early stages of discussion.
Okay.
But I can certainly add this to the list that would go under.
Yeah, I think that there needs to be a specific line that you can call when there's an absolute need, especially in the downtown area that's heavily trafficked with pedestrians.
Yep.
That really need to be restriped. And a comment on the motion you just passed regarding the letter concerning the assisted suicide issue. I know since 1973, when Roe versus Wade passed, we've all been indoctrinated into the fact that women should have the right to control their own bodies. And I think an assisted suicide bill is always an option for people who, with certain diagnostic backups and all of that other good stuff that the gentleman who called in talked about. You know, I want to have control over my destiny, and I don't want to be told that it's not an option, because whether there's an assisted suicide bill in place or not, a person can take whatever action he or she chooses to take without benefit of the law. And at least if the law is in place, there can be some kind of protections so that people can have informed consent. Just my own personal opinion. Thank you very much.
Thank you.
Thank you, David.
David reminded me of one other announcement I wanted to make.
Sure.
The city is looking for feedback from people with disabilities, if you have any, on the Uber Lyft drop-off pilot space on Boylston Street. There are 2 drop-off areas. If anyone has used them, if anybody has feedback, you can send it to me and I can pass it along, because it is a pilot study.
How are they being used right now, Kristen?
Right now, it's a 2-block radius, and if you want to get dropped off on Boylston Street, within this 2-block radius, they direct you to 2 specific areas. They direct the Uber or Lyft to 2 specific parking spaces.
And what's the 2-block radius, though, if I wanted to try it out?
It's near, Patricia, can you help me with this?
It's near Target in Boylston Street.
That's 1 block.
Near what?
Target.
The Target.
On Boylston,
Okay.
up near Fenway Park.
Oh,
Van
okay, yeah,
Ness.
over by,
Van Ness, yep.
yeah,
And then the other one is the next block up, which is near, what's that restaurant?
That's Tiger something.
Tiger Mama?
Near
Tiger
Sa-
Mama, yeah.
Okay,
Which is
got
right
it.
near there
I
as
may-
well.
I may be going to Tiger Mama for dinner tomorrow. We'll see.
Okay, let us know. And that was it, thanks.
Great, thank you. Do I hear a motion to adjourn?
I make a motion to adjourn.
Any seconds? Felicia seconds. All in favor?
Aye.
Any opposed? You're opposed, Carl? Okay, thank you, the motion carries. See you next month.
Chair can always overrule that.
Great job.
Thank you.